Hello everyone, welcome to my channel Learning Mind Crew, and I'm here with another video as I promised earlier. This will be the first of my many support material videos regarding OSCE updates and OSCE skills and APIEs. So I'm going to start with assessment station in APIE. So I'm sure many of you have already practicing or finding it difficult to perform. So I'm going to start with assessment station. Assessment station is one of the most easiest and also very interesting station in APIE skill. So let's go one by one. And so this video is all about the assessment station. Assessment station is 20 minutes overall, and I'm going to go through. Let's go to the next slide. So basically, first 5 basic steps you need to follow when you start with any skills, not only assessment. So first you will go into the patient's area, you will check scene safety of the patient, literally scan the room, scan the area where you are entering, and look for and verbalize loudly that scene is safe for you to approach the patient. Then step 2, introduce yourself. Tell that hello, my name is so and so, I'm here to take care of you, I'm here to do an A2E assessment on you, is that okay? So the patient will say yes. Then before you go and do the ID checks, start doing a proper hand hygiene following the 7 steps. So just verbalize loudly so that they know that you know the 7 steps of hand hygiene. Then after you finish your hand hygiene, you can start doing the ID checks on the patient. So we know there are 3 ID checks we need to do. If it is a hospital setting, you will be doing ID check on patient's name, patient's date of birth, and patient's MRN number. So when you are checking the name, you will be cross-checking with the document you have in hand, and when you are checking the date of birth, again you will be cross-checking with the document you have it in hand. And when it comes to MRN number, do not ask the patient the MRN number because they will not know. So you need to cross-check it with their wristband. And after you confirm all 3 checks, you will be proceeding to check the allergies and reactions of the patient. Remember, it is very important to ask allergies at this stage. Why? Because if you are not checking allergies at this time, later once you started using things, for example, you started using a gloves on the patient, and later when you are checking the allergies, what if the patient says patient is allergic to latex? So that's why it's very important to complete querying about allergies and reactions at the beginning itself. And after you complete all 5 basic initial steps, then you proceed to the APIE assessment. So before we go on to APIE assessment, let's talk a little bit about the different types of scenarios and things you may need to think about before you proceed. So in scenarios, you may have a hospital scenario, you may get a care home scenario, or you may get a patient's own home setup scenario where you will be a district nurse. So depends upon the scenario, the way you check the ID differs. For example, if it's a hospital setup, then definitely you will be checking the IDs of the name, the date of birth, and the MRN number of the patient. If it's a patient's own home setup, again you need to check the name and the date of birth, and here the patient will not have a wristband, so you need to ask the address of the patient. So it will be name, date of birth, and address of the patient. And once you confirm the 3 checks, then you proceed on with the asking about the allergies and reactions. And the way you escalate things at the end of ATE assessment also depends upon the scenarios. For example, if you are in a hospital, definitely you will say, okay, you have got some abnormal findings, and I will escalate it to your consultant, or I will escalate it to your doctor who is looking after you. But if it's a home setup, then you need to verbalize like, okay, Mr. E, I got these findings and I'm going to escalate it to your GP, or I will refer to a district nursing team, or depends upon whatever care the patient require, you need to escalate it, depends upon the scenario. So these are the things I would like to add on before we proceed with the ATE assessment. So remember, after you're entering into the scene, you're checking the scene safety, you're introducing yourself, you're doing a hand hygiene following 7 steps, then you're doing the ID checks. Why I placed hand hygiene before ID checks? Because ID check is the first time you're going to touch the patient, and according to the 5 movements of hand hygiene, before you touch the patient you should wash your hands. So that's why you need to do a hand hygiene before you do the ID check. Okay, I'm sure so far it is clear. So now let's go on to ATE assessment. Before you proceed ATE assessment, always start with gaining consent and explaining the procedure. So start by saying like, okay, Mr. E, I'm going to do an assessment on you, and I'm going to do systematically from airway to exposure. Is it okay? It will take some time. Are you comfortable right now? Do you want to go and use the restroom? And if you are comfortable and if you are okay, I can start. Is that fine? So the patient will give the consent, and patient will say, yes, you can start. So then you can start the ATE assessment starting from airway. So in A to E, A stands for airway, B stands for breathing, C stands for circulation, D stands for disability, and E stands for exposure. There are few people came to me and asked me like, is it okay if I can jumble up things, if I can check the breathing first, then I can go for disability, then I check circulation, what if I forgot something? So the best advice I could give is, please follow this order of assessment. Why? Because ATE assessment is designed in such a way that it is given more priority to particular system than the rest. For example, airway is more important because once you identify there is a problem with airway, and once you sort out that thing, automatically we can sort out a lot of other issues. For example, if a patient is unconscious and you're going to find, if you straight away go and check the breathing or circulation, the problem may be with the patient's airway. So if you go and check the airway first, and once you remove the blockage or the obstruction, automatically patient could have revived. So instead of wasting precious times, we could have started with the airway. So airway is very important. It is very easy to check. It has only 3 things. You're going to check for any visual obstruction, ask them to cough, and mention that since you're speaking in clear full sentences, I can say that your airway is open. Just 3 things you just needed to look for. And when it comes to breathing, there are 5 things to check: air entry, use of accessory muscle, abnormal breath sounds, saturation, and respiration rate. So in these 5 things, start always with air entry. So you can say like, I can look at your chest, and your chest is equally expanding and your air entry is equal on both the sides. And look at the patient's accessory muscle, and you can say like, you are not using your accessory muscle. And you can talk about abnormal breath sounds. There are few people who mentioned that since we are not using a stethoscope during assessment, how we can say that there is a abnormal breath sounds or not. What I would advise is, I always verbalize like, I can't hear any audible abnormal breath sounds. So if you mention audible, then it makes sense. So even even if you are not using a stethoscope, still if you have witnessed a respiratory patient with abnormal breath sounds like wheeze or stridor, you don't even need a stethoscope. You can literally able to hear from a distance also. So that's why when you assess the patient, you can mention like, I can't hear any audible abnormal breath sounds like wheeze or stridor. Then move on to the saturation. So when you are checking the saturation of the patient, so this is the first time you will be literally touching the patient. So you're going to put the saturation probe on the patient's hand, and before you put on, check for any nail polish and mention that nail polish is not there, so I can able to get a proper saturation. Why nail polish is a problem? Because nail polish, the saturation probe works in such a way that the reading is transmitted through some infrared signals, and the nail varnish or polish may alter that signal transmission. That's why we always say that there is no nail polish. So I'm happy to check saturation in that finger. And once you get the saturation, please do a hand hygiene, because this is the first time you touched the patient and you are moving away to do a small documentation. So you will document in the third page of the assessment booklet, where it is for your own rough notes. You can just make it, it's not assessed, so you can just make a note of the saturation. So please do a small hand hygiene there, and after noting the saturation, then come back to the patient again, and now you're going to check the pulse of the patient. Yes, you heard it right. So you're not going to straight away check the respiration. So you're going to couple it up with the circulation part, which is pulse rate. So you're going to check pulse and respiration for 2 full minutes. Remember, they're going to calculate literally whether you're monitoring the pulse and respiration for the 2 full minutes. So check pulse and respiration for the 2 full minutes using your fob watch. Then you can mention like, yes, and now I checked your pulse. Along with that, I checked your respiration as well. I didn't mention it to you earlier because that may alter your respiratory pattern. So your pulse is this much and your respiration is this much. You need to verbalize to the patient. When you are checking saturation in the monitor, automatically the heart rate will come. Please do not look at that heart rate, and the examiners also will explain it to you in the exam center, that you should never look at that heart rate, and you should never mention that heart rate well after you check the pulse rate, because they want you to literally check in a manual method. So after checking pulse and respiration, then you will move on to check the blood pressure. So in circulation, again there are 5 things to check: pulse rate, which we checked already along with respiration, blood pressure, capillary refill time, pallor, and perfusion. So when we come to blood pressure, so you need to do a simple assessment on the hand which the patient preferred. So for example, you can ask the patient like, okay, which hand do you prefer for me to check the blood pressure? So patient will say, yes, you can check it on my right arm. So then before you proceed, ask the patient, okay, can I assess your side? Patient will say yes. Okay, I'm looking for edema or any scar or burns, wound. So do you have any problems in this hand before? Did he had any surgery? Did he have any fistula, AV fistula in this arm? So did he undergone any mastectomy surgery on this side? Did he undergone any did you had any stroke issues before? So you ask all these questions, and if the patient say no, then you're happy to tie the blood pressure cuff on that hand. Then after tying the BP cuff, press the start button and the BP will start to read. So once you have the BP, so remove the BP cuff and mention it to the patient and record it. Then you can go on and check the capillary refill time. So just press the finger nail bed, and the capillary response time should be less than 2 seconds. That is normal. and you can verbalize loudly that there is no pallor by just looking at the nail bed, and you can touch the patient's hands, and you can say that your hands are warm to touch, so you are well perfused. So after you complete all these 5 things under circulation, you can move on to the disability part. So when it comes to disability part, 4 things to check. So first one is AVCPU, which is nothing but alert, verbally responsive, responding to pain and unresponsiveness, and pain, urine and glucose. Just remember like that: AVCPU, pain, urine and glucose. So first, in AVCPU you will check 3 things to identify whether patient is alert or not. So you will be checking orientation to time, place and person. So how will you check orientation to time, place and person? So you'll be asking them questions like, okay, do you know where you are? Do you know what time is it? Do you know whom you are speaking to? If they are answering all 3 questions correctly, then you can say that yes, I can see that you are alert and oriented. Then move on to the pain. So you can ask like, do you have any pain? So if they say yes, find out the location and also ask about the characteristic of pain. And you don't need to talk too much about the characteristics, because pain assessment is completely a different skill. So you just ask about where is the pain, okay, what type of pain, and straight away ask about the pain score. Okay, pain score you will do it from using a scale of 0 to 3, where 0 being no pain, 1 is mild pain, 2 is moderate pain and 3 is severe pain. So you will be asking them to rate their pain, and once they say yes, I have a pain score of 2, then do not go on to the next part, always address the issue. So throughout this A2E assessment, whenever you find something abnormal, do not act like you are following a script. So be very sensitive, be relevant, because whatever you are finding, and if you are finding something abnormal, delve deep into that aspect. For example, if the patient has pain, you can always say like, okay, for your pain, maybe do you want any comfortable position, or do you want some extra pillows? So what else could help you? Have you taken any pain medications before coming in? When is the last time you got some medication? So you can inquire those things. You can try to do some non-pharmacological intervention for that problem, but you can't straight away give medication in assessment station. So you will not be doing that part alone, but you can try to address the issue with whatever things you got and at whatever capacity. So after, for example, I just gave an example of pain. So for example, if the patient is a diabetic patient and patient has glucose, so BM is high, so maybe what you can do is you need to talk about what was your latest blood sugar level. Are you on medications? Are you on any diet regimen? Are you following it properly? What is the problem? Why it is causing a elevated blood sugar? So asking and addressing such issue is very key in your assessment. So let's go on to the next part, which is urine. So when you can ask about the bowel pattern as well along with the urine. So you can ask about how is your bowel and bladder pattern, is it normal? So especially if the patient comes with urinary tract infection or pyelonephritis, definitely patient will have some decreased urine output. So you need to ask more in detail about, okay, what is the color of your urine, how much urine you are passing, is it normal or abnormal, okay, do you have any painful micturition? So you need to inquire more about that particular aspect which is relevant to patients presenting compliance. So next is glucose. I already explained to you. So you need to inquire. You don't need to check the blood glucose at this time. You just need to inquire what is your current or latest blood sugar level, whether it is normal or abnormal. So you need to know about the normal values of blood sugar, which is another skill which I will put in a different video. Please look into it. And after disability, E for exposure. There's three things to check. First is temperature. So some CTC centers, they are asking people to use infrared thermometer. Before COVID, it was tympanic. So we just need to check the temperature of the patient and make a note of it. And the second is past medical history. So you need to ask, what is your past medical history? Why it is very important? Without the past medical history, so when you go to implementation station, when you start giving medications, there are certain medications which you can't give because patient may have a past medical history which can interfere with that current medication. For example, if the patient is having a past medical history of asthma, then if the current medication doctor has prescribed ibuprofen, then you can't give ibuprofen because it can cause bronchospasm. So I'm just giving an example. So what if the patient has a previous history of there are many medications which can be interfered by a past medical condition. So just be aware of it. I will post a separate video about it, and in the implementation station video. So that's why it's very important to check the past medical history here. And then the third aspect is asking about any bleeds, rash or wound in the body. Remember, in the first page of the assessment booklet itself, they will clearly mention that for exposure part, you don't need to expose the patient by removing the bed sheets. You just need to inquire and that would suffice. So if they mention clearly there on the first page, just don't ask the patient to open and show them their wounds and rashes, because it's going to be a real live actor. So, and the real live actor will not have a literal wound. So it is all assumption, and they will be giving a scenario, and they will be given a scenario and they're acting there. So they will say that they have a wound in the head, or they're having a wound in the knee. So for example, so that doesn't mean that literally there will be a wound on the knee. So even if you expose, there won't be any wound. So in the assessment booklet itself, they have clearly mentioned you don't need to expose them. So just ask them, do you have any bleeding or rash or wound anywhere in your body? So the actor will say, yes, I have it here, I have it there. So you take it as that and you can start documenting. So this is the complete comprehensive APIE assessment we have so far looked at. So now let's look at the tools which we need to complete in the assessment. So there are different tools we are using in assessment stage. There are new score, must score, GCS and PHQ-9. So I'm going to put separate videos for each tool because this video will not be enough to complete all the aspects. So I'm just going to I'm not going in detail. Just I want to mention that it can come in any combination, but GCS and news will not come together. Why? Because GCS also has a place where we will record the vital signs. News also has a place where we will record the vital signs. So most of the time, so either you will get GCS or news, but it will never come together. But you can come in, it can come in other combination, like you can get a news and a must, you can get a GCS and a must, you can get a news and PHQ-9, you can get a GCS and a PHQ-9, or you can even get a GCS must and a PHQ-9. So just be aware of it. And interpretation, please explain whatever you found out in the APIE assessment to the patient, and explain the results of the tool you did. For example, you got a PHQ-9 tool or a must tool, you got some results, abnormal finding, you need to explain that as well to the patient, and you need to provide recommendations. That's very, very important. So what you expect the patient to do after the finding, that is very important. That's one of the important thing in a marking criteria. If you don't do it, it will be a red flag. Now the general guidelines: maintain eye contact with the patient, never look at the examiner, avoid looking at the examiner. That's very important. Act like you are literally giving care for a real patient. Assume the scenario as a realistic scene. gain consent before touching the patient or performing anything which involve the patient. That's very, very important. Acknowledge and make sure that patient is comfortable in every aspect of your care. Just verbalize, are you okay, are you comfortable, can I proceed to the next step? That is very important. And when you are doing APIE assessment, and if you find anything abnormal or relevant to your condition, because in your assessment booklet, when you start the APIE assessment, you will take 1 or 2 minutes to read what is the presenting complaints. And for example, if the patient has diabetes, then you will go more in depth or into the blood glucose level in disability. If the patient has seizures, then you will go more in depth into the ABCPU. If the patient has, for example, came with pyelonephritis, you will go more in depth in the urine part. If the patient comes with a respiratory problem, you will go more in depth in the breathing aspect. So just be careful of what you are doing. So the whole point of this APIE assessment, it should not look like it is scripted. It looks like you are thinking and you are applying your knowledge to the current problem you were given to assess. So that's the end. We are concluding with, you're going to reassure and provide a call bell before you leave the patient's area. If it's a patient's home setup, provide contact details of where they have to call if they have any problem. Remove your PPE, do a hand washing, and leave the scene after completing the documentation. Try to be with follow your timing, because it's very important. If you are not doing the documentation, then it's again a fail. I'm sure this video would be very beneficial for people who are preparing for OSCE and for people who are coming into this country for the first time, who have no clue at all of what is APIE, how to do it. So just try to ask questions in the comment section, so that I could also able to address those questions, and I can able to answer you in the comments box. So please feel free to ask any questions in the assessment video, or if you have any feedback or any comments you would like to add on, something which I missed out, please feel free to share it so we can all benefit from it. Thank you so much and have a nice day.